Salam, hello. We will presenting a debate about should access to biobank data be restricted to researchers from the country of origin or should it be made freely available to the global scientific community? My name is Musaki Bikay. I am from Algeria and I am working with Walabi Peter from Nigeria. We are the Affirmative Team and we will talk about access to biobank data should be restricted to researchers from the country of origin. Biobanks, which are banks that store biological samples such as DNA, blood, and tissues, have become invaluable resources for advancing medical research and personalized medicine. These repositories offer insight into genetic, environmental, and lifestyle factors that influence health and disease. Biobanks are repositories for human biological samples and data, crucial for the research and diagnosis. They facilitate biomarker discovery, drug development, and serve as a link between academia and industry. Biomarkers' roles is evolving with advancement in big data and artificial intelligence, enhancing their importance in clinical and translational research. The main missions of various types of biobanks are provide biological samples that are integrated with clinical information, sharing clinical experiences, and contribute to building bridges between basic translational and clinical research and healthcare in various fields, cancer research, infections research, epidemiological study, and health-related quality of life deficits, and other areas like genetic and genomics. In our opening statement, a very important ethical and logistical questions arise. Should access to biobank data be limited to researchers in the country of origin, or should it be freely accessible to the global scientific community? To answer this question, this debate involves consideration for fairness, scientific progress, and donor rights. So, in this presentation, we will highlight the affirmative question that access to biobank data should be restricted to researchers from the country of origin. Knowing fully well that data unlocks newer improvement in genetic and genomics, we affirm that access to biobank data should be restricted to the researcher from the country of origin so as to protect national sovereignty, ensure careful and ethical use, and safeguard economic and scientific sovereignty and national interest. Biobank data should be controlled by the country of origin to ensure that resulting benefits in healthcare and biotechnology primarily serve the population that provide the sample, as it is considered as a national resource. Preventing exploitation. There is a risk that unrestricted global access could lead to exploitation of the data by foreign entities who might prioritize profit over public health benefit. Limiting access ensures that the data is not used for purposes that might not benefit the country of origin. Protection of local population. Restricting access helps protect the interests of the local population, ensuring that research conducted with their data align with their cultural and ethical standards. We can categorize the benefit of limiting use of biobank data to researchers from the country of origin into research benefit, collaboration benefit, ethical benefit, regulatory benefit, and finally, economical benefit. Research benefits are presented in preservation of national interest. Restricting access ensures that the benefit of research based on national biobank data primarily serve the country's population. prevent the exploitation of local resource by foreign entity without proper acknowledgement of benefit sharing, and focused research priorities. Local researchers often have a deeper understanding of the specific health challenges and needs of their population, which can result in research that is more relevant and beneficial to local healthcare outcomes. Collaboration benefits are represented by strengthen and support local collaboration. Restricting access can encourage stronger collaboration between local institutions and researchers, thereby fostering a sense of national scientific community. Local capacity building. National restricting can ensure that collaboration with international researchers involve capacity building, technology transfer, and training of local scientists, which can improve the local research ecosystems. The ethical benefit by respect for sovereignty. The country have the sovereign right to control their genetic resources. Restricting access ensure that the country of origin maintain authority over how its citizens' genetic information is used, preventing exploitation by wealthier nations. Benefit sharing. Local access ensure that any benefit derived from the use of biobanks data, example new treatment or public health intervention, are first made available to the population that contributed to the regulatory and legal consideration. Benefits are represented in control over data use. National restrictions allow for better regulatory oversight and control over how biobank data is used, ensuring compliance with the local law and regulations. Prevention of data misuse. By restricting access, countries can reduce the risk of misuse of sensitive data, including potential breaches of privacy and unauthorized secondary use of data. Economic benefits are presented in economic incentives. Restricted access can create economic incentive for local industries, including biotechnology and pharmaceutical companies, to invest in the country, and retention of value. Keeping data within the country ensures that any commercial application of data, such as development of a new drug or therapies, primarily benefit the local. Now we pass to rebuttal. Restricting access to biobank data to only local researchers can significantly slow down the pace of scientific discovery. Global health challenges such as infectious disease, cancer, and chronic illness often require collaborative effort across borders to develop effective treatment and interventions. International collaboration enables the sharing of diverse datasets, which can lead to more robust and generalizable research funding. For example, studies that combine data from multiple populations can identify genetic variations that are more common in certain ethnic groups, leading to more personalized medicine approach. Limiting biobank data access to local researchers impedes scientific advancement, global cooperation, and research impact on public health. African initiatives like HT Africa and the Data Science Initiative Africa showcase the advantages of international collaboration in biobank research. Legal frameworks like the Nagoya Protocol and emerging DSI Africa laws offer a balanced approach, promoting both national interest and global cooperation in public health emergencies, and restricted data sharing has proven to be vital in saving life and mitigating the effect of disease. Global collaboration vs exploitation. Global scientific collaboration can accelerate progress but often disadvantages data originating countries. Resource-rich nations are better positioned to use data, resulting in unequal benefits and reinforcing global disparities. Restricting access doesn't mean halting collaboration. It means entering into partnerships that are equitable and mutually beneficial. Countries can negotiate data sharing agreements that ensure fair returns, such as access to research funding, co-authorship, or capacity building initiatives. Ethical responsibility. Ethical research must balance scientific progress with protecting data, providing communities rights and interests. Unrestricted access may prioritize global research agendas over local needs and values, potentially compromising ethical responsibilities. Controlled access allows for ethical oversight, ensuring that research is conducted in ways that are consistent with the participants' consents and the ethical standards of the country of origin. DSE Data Science Initiative Africa Law. Some African countries under the DSI Africa Initiative have developed or in the process of developing legal frameworks to govern data sharing and collaboration. These laws are designed to protect the interests of African countries while also facilitating global partnership. This is some countries and their law and acts. Now we are looking at the map of Africa. All the green countries have data protection law in place. The yellow countries have bill or law project, while the red countries there is nothing currently. But we believe that they will follow the other countries sooner. As conclusion and closing statement, restricting access to biobank data is crucial for protecting national sovereignty, ensuring ethical use, and supporting economic and scientific interests. Collaboration with global researchers can still occur through negotiated agreements that respect the country of origin's rights and priorities. Unrestricted global access risk exploitation, privacy breaches, and loss of national control over valuable genetic resources. Our stance balances the need for scientific progress with the ethical and economic protection of the country of origin. This is some references used in this presentation. Thank you for your time and your attention.